Hi, my name is Heather Foltz. This is week 2, discussion 2 question. For this scenario in this case, I am going with the plaintiff um, regarding the fact that she worked for Ashford and is also a patient there. She alleged that her supervisor seen information that had nothing to do with her. Ashford Hospital distributed an OR schedule to employees via email. The hospital OR schedule contained information about the patient's upcoming surgery. Along with that, they also disclosed information about the patient, her social security number, her birthday, age, residence, insurance, and payment information, former surgeries that she had, current medications and past medications that she's been on, um, past medical conditions, her primary care physician, and other professionals that she had seen throughout the past years. The patient supervisor was not part of the OR team, or was she part of the treatment team, but she was considered to be in a supervised administration position within the facility, which does actually give her access to the patient's information, but regarding this case, she does not need to be part of the information, given the information, considering she is not part of the team and will not be in the OR. Patients' records are confidentiality and cannot be shared with anybody except for if it is ruled in a court that is stated that the patient's records should be released to a specific law enforcement agency to go over the information or to be distributed to where it needs to be. Patients' records cannot be shared with anyone unless there is a signed release of information by the patient clearly indicating anyone could see these records. And with that information regarding HIPAA law, HIPAA complaint or compliant authorization are required by hospital doctors or anyone else covered in HIPAA for the exchange of protection information of all authorized persons contain what information needs to be disclosed, to whom the information is disclosed to, when the authorization expires, and the signature and date of the person that's releasing the information to anybody who they feel that needs the information. Because the healthcare facility often uses technology devices like computers, hospital security policies have been put into place to protect patients' privacy while operating these machines, as well as HIPAA has also put this in their policy. Regarding hospitals are required to have limited access through users' names and passwords to protect patient information. These prevent unauthorized users to breach client privacy. In this case, yes, her supervisor might have the authority to go in and access the information, but she is not part of the team, nor is she a part of the recovery team. So therefore, she has no right to access the information. People like the billing department, the medication department, the doctors, and people who will be taking care of her afterwards have that right to go in and access that information. But in this particular case, her supervisor does not and should not have been in there. Um, so, thank you.